Hello, everyone, and welcome to Healthcare Goes Plant Forward, Lessons for Our Industry. Be sure to type your questions in the chat, and it is my pleasure to introduce our presenters today to kick off this breakout session.
Hi, everyone. Thank you so much for joining this breakout session. As Casey said, this is Healthcare Goes Plant Forward, Lessons for Our Industry. I'm Kelsey Nash, Editor-in-Chief of FoodService Director magazine, and I'll be moderating today's discussion. It's so wonderful to be with all of you today at Menus of Change. The idea for this particular session came out of a new partnership between FoodService Director and the CIA that serves to highlight the evolving role of food in healthcare and really take a look at hospitals and senior living facilities across the country that are approaching plant-forward cuisine in exciting and innovative ways. And we are so lucky to have representatives from 3 such facilities on our panel today. Now, we know not all of you tuning into today's session work in healthcare. We have folks joining us from all across the spectrum of food service, but there will certainly be plenty of takeaways for everyone in what our panelists have to share. We have a ton to dig into this afternoon, but we will try to leave a few minutes for audience questions, as Casey mentioned. So if you do have a question pop up throughout the session, please feel free to enter it into the Q&A tab, and we'll try to get to it if we've got time. So it is my pleasure to be sharing the screen today with 3 esteemed individuals in healthcare food service. And I think they all probably know themselves a little bit better than I do, so I'm going to give each of them a chance to share a little bit about themselves and their operation. So Gina, why don't we go ahead and start with you?
Sure. Hi, everyone. My name is Gina Sadowski. I am joining you today from Seattle Children's Hospital, where I serve as the Director for Nutrition, Culinary, and Retail. I have the opportunity to lead a diverse group of individuals and oversee our culinary operations, inclusive of patient and family room service, catering, a full-service cafe, a coffee kiosk at an off-site location, a late-night staff meal service, and a lunch delivery program that we just implemented during these COVID times. We also oversee retail operations such as a gift shop, vending, and 4 Starbucks locations enterprise-wide. My background is in nutrition. I was clinically trained as a registered dietitian, but then, of course, realizing my lack of kitchen cred, I returned to school and got a degree from the culinary degree from the Art Institute of Seattle, which unfortunately is no longer standing, and also obtained my master's in healthcare administration. So I'm honored to join you all virtually today, and thank you for having me.
Hi, how are you? My name is Nazim Khan. I'm the Executive Chef, Brian Health System. And this is my first job with the healthcare industry. Prior to that, I was always Executive Chef, Hilton Marriott, Executive Chef for Virginia Polytechnic Institute, too, as a student. We are 600-bed to just groundbreak our new cancer center that we are building. It's a nonprofit organizations and healthy organizations, and we have a cafeteria throughout our 2 campuses, doctors' lounges, Brian Coffee Bean, that we proudly brew our local roasting bean from the local vendors and stuff. And I'm a food council member of Nebraska, and I like to work with the farmers. That's the big things for me. When I work in a hotel, work under certified master chef, Chef George McNeil, we always try to bring local food to our tables in a Hilton Marriott, a luxury brand of curio. So I'm in a hospital, been here 6 years, and locally I know all my farmers grow. Every Sunday, I educate our local community how we can turn into to any explore that. And I believe in food works as a medicine, and I'm in a noble journey to helping others, makes a smile on the face, and working hard every day. Thank you. And thanks for having me into this platform, speaking about the plant-based, plant-made forward.
Absolutely. Those farmers markets sound like so much fun. Jody, how about yourself?
Absolutely. Hello, everyone. My name is Jody Krefitz. I'm the Director of Food Services for Stanford Healthcare, overseeing both patient dining and retail operations. Stanford Hospital is an over 600-bed academic medical center located in Stanford, California, with a mission-driven philosophy to care, to educate, and to discover. Stanford Healthcare has been on its food transformation journey for about 8 years now, focusing on as many local, sustainable, and seasonal options as possible, inclusive of antibiotic-free, hormone-free meats, sustainable seafood, and providing plant-forward options. It's my pleasure to be here today. Thank you so much.
Wonderful. Thanks to all of you for being here. To get things started, Gina and Nazim, you've both been asked to join us today because your respective facilities were selected as plant-forward healthcare operations to watch by FoodService Director and the CIA. Gina, what do you think it is that sets your operation apart when it comes to a focus on plant-forward?
Yeah, I think probably right now the biggest piece that we are focusing on is the whole idea of less meat, better meat. So the more that we reduce our overall meat portions, the more resources available for high quality meats when we do bring them in. So antibiotic-free meats, local, sustainable, grass-fed. And we really try to offer customer choice, meaning the base of the dish is vegetarian or vegan, and allowing protein choices on top of that, whether they be meat-based, plant-based, legumes, and really allowing the flexibility for our customer base, but really focusing on that less meat, better meat, so that the meat that we are bringing in is high quality and better for our environment, but our overall basis of the foundation of our meals is plant-based.
Absolutely. And I think you've mentioned to me too, as well, when we've talked previously, that the antibiotic-free is really an important aspect at your operation when it comes to meat. Could you discuss that a little bit?
Yeah, absolutely. And we actually have partnership with our physicians that lead our antibiotic stewardship program. So that's something that's really important to us. We have really increased our percentage of antibiotic-free meats. We're actually at about 80% right now. So about 80% of our total meats are antibiotic-free meats, which a few years ago was impossible to do because it just wasn't there in the market. You couldn't even source the products that you were looking for. So in general has made huge leaps and bounds in that aspect, but really wanting to save those antibiotics for when we really need them, and rather than just baseline administer to our livestock. So antibiotic-free meats is something that we're very passionate about, and I think it's something that the whole healthcare community can really get around.
Sure, absolutely. And Nazim, how about you? We've talked several times before about Bryan Health being located in what you call meat and potatoes country. So could you kind of talk to us about the general attitude about plant forward in Lincoln, Nebraska, and how your team is pushing the envelope there?
Yeah, like my son said, we have more cows than people in potato country. And actually, I mean, all my culinary journey start from try to play with all different type of veggies to everything's work. But Master Chef, I get to explore melting pot. So in Nebraska, if we educate our clientele, our doctors, nurses, patients, family, they will take it the better way, receive better way that plant-based than meat. But we need to educate it, right? That's the whole goal. And on top of that, of course, you have to explore the flavor profile. It's not only like good quality of meat you put on a grill with little salt and pepper. It plant-based like or other things. If you don't have the flavor, not really enjoying that plant-based protein or plant-based meat that out there. So since I had exposed to so many, and I'm able to twist them all different direction and educate my teammates, serving my salad, so they need to able to explain that, hey, this is how it's been created, it texture like that, or taco tostadas, instead of a taco beef meat, you're getting quinoa and and tofu protein. So, but flavor profile is there, texture-wise close to meat, so you're good to go. So education is a key factor for me, and I try to support local farmers too. So whatever veggies, salad, leaves, microgreen, what I can put on a plate, that also I highlight that, hey, this plant-based meat or protein dish is going with microgreen or baby greens coming from Robinette Farm, that is our local farm. So it kind of educating them, hey, you're getting the macronutrients from locally resourced than getting it from somewhere else that's sitting into the refrigerator truck or picked up 2 to 3 weeks ago. That's how I approach them, and education is the key factor, and they're receiving thing.
Yeah, and I think they've received it so well that you opened a plant-based station last year. Isn't that right?
Yeah, I did. I have 5 days plant-based stations going on. And also, I like the way Gina said that less meat is a better meat. And I like to use that slogan to my hospital too. Less meat is better meat for you.
Yeah, we're all learning from each other. So Jody, as Nazim just mentioned, that customer education piece is so vital when it comes to encouraging menu exploration and getting buy-in. Your operation has a Know Your Food, Know Your Farmer program that I know has been key to educating diners as well as staff about things like sustainability and transparency. How would you say that program has helped define your food service philosophy at Stanford Healthcare, and how has that evolved over time?
Great question. The Know Your Farmer, Know Your Food program is focused on educating our Stanford healthcare community, as stated, on sustainable food principles and initiatives. QR codes are available on the cafeteria signage for customers to learn about the farms we utilize and for further education. QR codes are also utilized at our stations for the recipes for our newly featured plant-forward options. So these options can then be recreated at home. Additional educational components we were able to implement over the past year included a virtual wellness holiday cooking demonstration featuring plant-based recipes, chef demo video collaborations with our dietitians for Health Matters, which is a free community event hosted by Stanford Medicine that explores the latest advances in medicine, health, and wellness. So the education continues, and we continue to further that involvement.
Absolutely. I know you mentioned earlier your sustainable seafood initiative. I understand that's kind of a key part there as well. Could you describe that a little more?
Oh, absolutely. So we look for all of our menus, and we'll talk about it, I know, in a little bit, across not only our retail establishments, but across our patient dining program as well, to make sure that our sustainable seafood, we love to utilize the Monterey Bay Aquarium app to teach others to utilize that as well, so that when you're in the grocery store, or you're out in your real life and able to take a look at what is the most sustainable purchase that you can make at that time. And we implement those same offerings for local purchases here at Stanford.
That's great. Now, we know there are certainly nuances at every operation depending on your location, the population served. We've all kind of touched on that a little bit so far. But Gina, you've mentioned to me how many of the young patients at Seattle Children's are sort of these foodies in training. They're very willing to try new flavors and ingredients. How does that impact what you and your team put on the menu and kind of your overall approach?
Yeah, we call that population our age. It stands for adolescent and young adults. So many of them are budding foodies. And I think we talked about, we had a patient here that was recently a contestant on either, I think it was Chopped Junior or Top Chef Junior, one of those food shows. So that was really cool and a really fun partnership to have insight. But that population, they're, like I said, they're budding foodies, and they're looking for something new, and they are more willing to try new and exciting and different flavors. Some of our younger kiddos are oftentimes, especially if they're not feeling well, they're looking for something familiar. So they're looking for what they typically eat at home. Whereas this older population, they're really bold and daring and wanting to try new flavors and new spices. So that's a population that we can experiment with our recipe development and have them do some taste tests for us and give us some feedback and help guide our menus in the future.
Yeah, to dig a little deeper into that, Gina, you've also described certain sensitivities that become really important when you're kind of promoting healthier items, maybe more plant-forward items to your specific hospital population. Could you explain that a little bit?
Yeah, so our kids, especially depending on what treatment they're undergoing, they may have aversions to certain textures and flavors that they didn't have prior. So they may be looking for really bold flavors, high citrus, high acid, cooling flavors, especially if they're undergoing cancer treatment. So oftentimes they're looking for shakes and slushies and smoothies and fresh juices. We have a juicing station in the kitchen that we like to play around with some of our fresh produce and make some exciting juices for our kiddos. And it's really fun to get their feedback and get them excited about food when, in general, it might not be the most exciting time for them when they're in the hospital, but at least this is something that they can look forward to.
Mm-hmm. Absolutely. And on the topic of patient feeding, Jody, I understand your team just rolled out a new patient menu. Congratulations on that. Can you share with us a bit about how that process went and how Plant Forward and sustainability played a role in what's being offered?
Oh, absolutely. It was around a 10-month process, lots of trial and error. Lots of nutrition components involved with it also. And the new patient menu has been really well received. It includes chef-featured meals with a continued focus on our sustainability initiatives to really provide suggested pairings that include cohesive offerings with complementary flavor profiles. For example, our Baja fish tacos are with local sustainable Pacific rock cod, seasoned black beans, and a house-made salsa verde. Or we have Tuscan herb local organic tofu with a vegetable orzo. Of the 20 new menu additions, 13 of them happen to be vegan or vegetarian. Also organic items, sustainably caught seafood, antibiotic-free, hormone-free meats, cage-free eggs. They're all noted with symbols on the menu, again, adding to that education piece. And it really, the rollout furthers our transformational platform along all lines of the food services program here at Stanford.
Absolutely. Now, Chef Nazim, you mentioned earlier you come from a background in hotel food service. You mentioned working in hotels in New York City and so on. How does menuing Plant Forward and other sorts of differ in the hospital context? I think we've talked a little bit about maybe some budgetary differences, but I'm sure there are others as well.
Working in hotels and stuff, you kind of get exposed to working with all different type of resourced food and stuff. But coming to health, works as a medicine, so you need to be a cutting edge. We live in, if IT, we new things, every sector we have to learn new things. The same thing. So we need to help and develop that what is the trendy, what people are looking into, sustainability, local growers, these are the things people look for when they go for dining. So as a healthcare chef, I have to kind of stay into that course and try to find out what would be the good resource for our patients' family, doctors, nurse, and all our department. So that way we all can stay healthy and cook good meal and enjoy a good meal and live long. That's the whole goal. And that, as a healthcare chef, I twist off different type of recipes and get going.
Yeah, absolutely. And I think when we talked previously, you mentioned scratch cooking being a real key component and kind of helping out with the budget and getting buy-in. Could you chat about that a bit?
Yeah. So when I came on board, is nothing wrong with that. Mostly all frozen back food, including the soup that we had to heat, like kind of sous vide cooking style. But when I came in from hotel industry chef, cooking from scratch, I could not take that. So I said, let's start making scratch soup. Let's start braising our own meat. So I had to create plant with our local health department. So I have a 3 blast chiller for both all my 2 campuses. And we make our own soup, bag our own soup, vacuum seal and freeze it and cook it. And also local growers, when they grow, like this year, they're growing lots of chickpeas, but I'm having them to dry it out and they send it to me. So it will be my next year falafel made from our local chickpeas. So stuff like that. So you work with the farmers, you work with your vendor, you try to do scratch cooking. So that kind of cuts down your cost down, but you need to have some sort of, employee engagement with that. Otherwise, you're not going to be able to sell that.
Yeah, absolutely. And kind of to continue on that topic, Jody, what have been the cost implications at your operation of shifting the focus to more produce?
Sure. Great question. Really, seasonal offerings are a particular focus for us for cost savings. If the produce is in season, it tends to be of peak flavor, quality, and availability. It's really a core philosophy in our ingredient-driven menu design.
Yeah, absolutely. And then to stick with you for a minute, Jody, a member of your team recently created a dish that was named the winner of Healthcare Without Harm's 2020 Healthcare Culinary Contest. Super exciting. And this contest challenged entrants to reinvent hospital food with a plant-forward bent. Casey, I think we do have a photo of the chef in that winning dish, if we can put that up on the screen for everybody. But Jody, could you talk a little bit about that dish and what that win meant to you, to Chef Noriel, and to your team overall?
Oh, absolutely. We're thrilled with this. The winning dish, titled Adobo de la Tierra, represents Chef Noriel's version of his childhood favorite, but with a plant-forward focus. The earthiness of the sauce provided with the mushrooms, the firm texture of the tofu, and the combination of the sweet and spicy achara work together to really awaken the palate. Chef Noriel brings together the best of that Northern California has to offer. And from celebrating the handcrafted, locally made organic tofu to really paying respects to the local produce here. The house-made plant-based protein consisting of tofu, garbanzo beans, red kidney beans, cannellini beans, quinoa, couscous, lentils, and shiitake mushrooms, onions, also some roasted jalapeno peppers with the adobo sauce presented in a lettuce cup, as you can see here, topped with achara and served with basmati rice. We were able to do this in both the retail and the patient dining menus as specials. Chef Noriel's devotion to his craft and to his Adobo de la Tierra is really well suited in a food transformation theme at Stanford Healthcare because it has really brought the plants, fruits and veg to the center of the plate, reduces the use of animal proteins, and does so with the vision of being globally inspired and locally crafted. We're really truly honored to receive the award, and it has sparked infinite creativity amongst the team.
Yeah, well, it sounds amazing. I'm very glad this session is happening after lunch because it would have been tough if it was before. Now, Nazim, I understand you've also had some personal success with Plant Forward. You took an entirely vegan approach when taking your certified master chef exam, which I believe was a first for them. Could you explain why you chose that path and also describe the dishes you chose to prepare?
Yeah, earlier, I say that, we need to be cutting edge and work with the trend. So when I applied for my CMC certified master chef through a World Chef Association, then I realized that, okay, I have a CEC certified executive chef from American Culinary Federation, so I can cook. I had to cook lobster, I had to break down a chicken, fish, and all those things I have done. So that is the requirement to become a world certified master chef also. So I said, this time I'm going to go completely vegetarian, plant-based protein. So I did 4-course meal. So they asked me a question. They asked me, chef, why you put main course is your kofta and other things, veggie kofta, chicken or fish, lamb or any other thing. I said, well, you guys cook. I already proved that to Federation. Tell them everywhere, but edge moment for up with the trend and food work as a medicine that all talk. So in healthcare and try to meet our customer patients complete meal more. So like my answer and then the questions and all the other checklists. So I think I passed. So I got the world certification.
Yeah, well, congratulations. That's an awesome approach, and I'm so glad that they were receptive. And yeah, could you talk a little bit about what you made as well? I think we've talked about that before, and again, delicious things to discuss today.
Yeah. Well, I did falafel. That falafel is our Monday menu, and that chickpea falafel that we make from chickpeas, but that is completely from scratch. Most of our chickpea comes from from local growers. So I make the falafel, I make the hummus, I make the tzatziki sauce, I make some tomato cucumber salsa going with that. So that was my first course, pairing with the white wine. And then I had my second course was tofu kofta tikka masala with tikka sauce. And roasted curry cauliflower and with a creamy coconut cream based tikka masala sauce. And then also I did for dessert, I did cake without a yogurt based chocolate cake with the chocolate ganache. Instead of butter, I used and piled that on top of it. Did some tuile as a garnish, and I guess they liked it, and recipe yield was right. Menu overseas yield correct. So I know my menu. That way, every dish that I talked about. So everything went well, and
Well, perfect. Congrats again. Now I'd like to switch gears a little bit. We know virtually no food service operation has come out of the last year unscathed, and working in healthcare certainly posed some additional challenges there. Gina, how has the pandemic in particular had an impact on your menu efforts?
Yeah, great question. And certainly it seems to be ever changing. Distribution has been a challenge, and it remains a challenge every week, every day. There's something, another product that's difficult to obtain and source, which in healthcare, all of your food items are dictated in your menu software system. And so it's been a challenge to keep those alternate items current in your menu software system, because you're screening with patients with allergies and different diet restrictions. So that's been a big challenge. And in terms of our sustainability efforts, there were certainly some areas that took a hit. So for instance, we track local sustainable purchasing. And that was an area that we lost some traction because unfortunately, as much as it's heartbreaking to say, some of our local purveyors are no longer in business. They weren't able to survive the pandemic, despite kind of outpouring of support from the community. So we did lose some traction in our metrics regarding local purchasing. But, there's been some silver linings, too. Our volumes have been depressed over the past year and a half, as I'm sure in most places have been. And due to our low volumes, it's allowed us some time to really double down our efforts on our plant-forward menuing. So we've been spending a lot of time in menu development. And I see, Jody mentioned, too, a new patient menu rolled out. We were also working on a new patient menu, as well as some new retail menus. And it allowed us to move forward with a new business venture, which was the delivery. Customers can order on their phone using an app, and we deliver. We have drop locations all around campus that we deliver to. So there really has been some positives that have come out of it, but it hasn't been necessarily at the loss of a few other things that were important to us, and we hope they rebound.
Sure, absolutely. Nazim, I saw you nodding along in agreement at the beginning when Gina was talking. Do you have additional thoughts on this, on the pandemic's impact?
Is that me or?
Jody, help. Oh, yeah, sorry.
Oh, Jody.
I think we might be having a little bit of a lag here. But Jody, do you have any thoughts there? What was the impact that you saw at Stanford?
Oh, absolutely. And we're right there with what Gina's notions were. Over 100 different substitutions for the patient menu and programming that into our systems, and supply chain challenges are a daily task, and continue to be as products become unavailable. And how can we meet the nutritional requirements of not only the retail environment but of patient dining program also with the products that are available. So it truly is active daily management.
Sure. And I think we can all attest flexibility has been the name of the game for the last several months. I think a large part of that too of that flexibility is making sure that staff are able to adapt with the changes that come their way. Nazim, you've talked a couple of times about engaging employees and getting them to be ambassadors for your menu and your strategies. How do you sort of rally your staff around Plant Forward and empower them to be ambassadors for dishes or ingredients that guests may never have heard of or not be familiar with?
Yeah. So 60 to 70% guest is our in-house guest. So we are 5,000 employee hospital. So, they all come to cafeteria, all the nurses, doctors. So any menu items that put it out as a new menu item, work with, stand there for at least 2 weeks to 3 weeks and educate the customer. It could be nurse, it could be from EVS department, anywhere. But I explain where that coming from, how we did it, what is the cooking techniques being used, how the fresh veggie was prepared, how was the meat was prepared, or plant-based. And there's some literature, and I leave, local, we support local. If the cheese coming from Shadowbrook Farm, I have a laminated paper from them talking about the history of their farm and who does that. So when I talk about those things and say jicama, how the jicama tastes like, I always say that, okay, jicama is kind of, it's a potato family, but tastes like apple, no sourness. It has a crunchy bite. When I talks about it, this nurses and also the serving, they're all around with list stuff. So if a guest family member comes to, they said, "What is this?" Oh, jicama. Okay, well, always nurses explain, oh, it tastes like an apple, no sour, but it's a potato family. It sounded so cool. So I'm standing there, I don't have to explain anymore. They're the one who is explaining for me. So I have a noodle bowl stations, I have pizza stations, all the stations. That's how they educate. And I also talk to them every week. I talk to them, hey, this is the menu I'm working on it. Let's get your feedback. What do you think? What direction we can put out? Do you think customer will like it? Or how we should be explaining to them? Or what you think when you're tasting, how that tastes like, So this education piece is very important for your teammates and also, whoever into the hospital or any workplaces.
Yeah, I love that jicama description. You're going to hear me saying it around town too. On that topic of employee engagement, Jody, I know in some of our previous discussions, you've talked about kind of the importance of having a common mission and getting everyone's buy-in on that mission. Can you share how that philosophy has been central to your team's success and how you go about making sure that everyone's on board?
Oh, absolutely. Really maintaining the focus on the core values and the guiding principles of plant-forward, clean options, antibiotic-free, hormone-free meats, shifting the center of the plate, sustainable seafood, as we've spoken about, in regards to menu design, is not really about taking away, but rather providing cleaner options. But the mission really goes beyond the food itself to additional sustainability components, waste reduction efforts, all compostable serviceware, elimination of plastic straws in our retail environment. We're involved in a local food donation program. Recently, we had an Earth Day celebration featuring local vendors and sustainable cutlery sets. So the mission really continues to drive the actions to yield outcomes. We continuously ask ourselves, what additional efforts can we put forth to reduce our carbon footprint?
Great. Well, I think we do have a few audience questions that are floating in, so I'm going to try to take a look at some of those. I know we're kind of running down on time here. Jody, there's one specifically here for you about how long the QR code program has been in effect. And they're asking, how many menu items do you have in your full transparency menu with the make at home recipes?
Oh, that is a great question. I don't have the complete number off the top of my head of the number of the QR codes that we have for the specific recipes, but we have had that in the QR codes initiated for a couple of years now.
Okay, great. Chef Nazim, I think this one is probably for you. Does the plant-based space station mean vegetarian? Does it have any meat and seafood in it, or do you have a maximum of maybe, for example, 2 ounces of meat per meal?
All my plant is 100% plant-based. Meat, egg, or involved. So like saying like taco tostadas, is completely plant-based protein, quinoa. All other lettuce and vegan cheeses.
Sure, absolutely. Gina, I'll toss this one to you. This person asks, have you had any success with product placement, such as placing healthier options front and center, or also perhaps suggestive pricing, making healthier items less expensive than the unhealthy ones?
Yeah, great question. And actually, a few years ago, we were researching heavily the behavioral economics of healthy food choices in the cafe and our retail environments. I guess, to be real, our cafe is in dire need of renovation. So some of the placement issues are a bit challenging. We have certainly done work with pricing, though. Not necessarily price incentivizing, but price equalizing. So for instance, oftentimes at the grocery store, at a restaurant, some of the healthier dishes you see are actually priced at a premium above your typical burgers and fries and some of your, chicken nuggets and more processed foods. We've really tried to price equalize. So the healthy option is similar in price, if not equal in price, to some of your more traditional processed options. We've done that with beverages, especially making sure that our fruit juices and no added sugar beverages are price equalized to the sugar sweetened beverage free sugar, we are a sugar sweetened beverage free facility is what I was meaning to say, but we've equalized our beverages across the spectrum on the menu.
Great. And we've got I think maybe time for one more question here. Jody, I'll throw this one your way. Someone asks, are patient menus delivered as room service or tray line? And do you have specials on the room service menu or a larger rotation of the patient menu?
Absolutely. Yes, it's a room service that we have. It is our operating hours are 6 a.m. to 9 p.m. And we do run specials for holidays on a monthly basis. Also putting forth our sustainability initiatives.
Great. Wonderful.
All right.
Casey, we'll welcome you back in.
Thank you so much. So everyone stay tuned till the end of this session as our presenters will share with you their one sentence takeaway from today's conversation after we provide some brief instructions for the upcoming networking time sponsored by Kellogg's Away from Home. In the sessions tab, we have Kevin Mitchell, Sophie Egan, and Eve Turo-Paul with their Meet the Author sessions, as well as the networking tab on the left for a 4-minute one-on-one video chat. Today's icebreaker question is, what is your primary sustainability priority for 2021? Or head to the Innovation Hub to see culinary demos, insightful presentations, and plant forward innovation inspiration from our generous sponsors. Enjoy these networking activities, and we'll be live on stage at 2 p.m. Pacific, 5 p.m. Eastern for our next general session focused on strategies and innovation for rebuilding. All right, so let's throw it back to our presenters for their one sentence takeaway. Jody, would you like to start?
Oh, absolutely. It may be a little longer than one sentence, but I do want to say that, we want to educate and ask for help and support. Small steps are definitely components of an incredible journey. It can be done. Change doesn't happen overnight. Break down the vision into accomplishable steps, and it will lead to something truly remarkable, measurable, and it will lead to impactful change.
Perfect. Gina?
Well, while I second what Jody said about education, I will take a different spin, and I would say if you're looking for a place to start, I feel like the foundation of sustainability is reduction of food waste. There's really no sense in, bringing in your premium ingredients if half of it's going in the garbage and the compost. So if you're looking for a place to start your journey, I would recommend with reducing the food waste.
All right, Nazim.
Yeah, Gina, just one thing. We need to make sure that we're not wasting anything. We properly utilize every single things in your kitchen. And the thing I wanted to say, food works as a makes people happy. So we are in a noble sure that have fun cooking and learn your ingredients, know the world. So we got tons of spices around the world. So, and also tons of stuff to eat as a vegetarian and vegan. And life, you don't need to figure out a vegetarian meal. Try to learn your lentils, legumes, veggies, and have fun cooking.
Perfect. Thank you. Kelsey, any last thing you'd like to add?
Nothing. I'm just absorbing all of this great information that I've been hearing over the last 40 minutes. I just wanted to say a thank you to Gina, Jody, and Nazim for sharing all of your insights with us today. This was so informative, and I know everyone listening and watching is going to take all of the insights you gave us today and go running with them. So thank you again.
Perfect. Yeah, big thank you to our presenters here and to FoodService Director for collaborating with us on this project. See you all in 20 minutes for our next general session. Enjoy the networking. Thank you.
Bye-bye.
Thank you so much.